The National Peak for Indigenous Health Services says an increased rate of eye health checks among our mob is a credit to the care provided by Aboriginal medical services. The comment comes following the release of the Indigenous Eye Health Measures 2020 report by the Australian Institute of Health and Welfare, which found a significant increase in eye health exams among Indigenous people. The report found the rates of our mob accessing cataract surgery, diabetic retinopathy screening, and eye health exams have grown from 11% to 33%. Chair of the National Community Controlled Health Organisation, Donnella Mills, has credited the effort to the Aboriginal medical services, saying the government needs to increase investment in the area.
Let's just start from the principle of our people, strong, empowered, self-determining communities. What the ACCHO report, is really telling us is that we are seeing more Aboriginal and Torres Strait Islander people accessing eye health services through our health assessments, and that is so, so important. And when they're accessing those health assessments, that early intervention means that we can start to prevent, avoiding the outcome of blindness. What we're seeing is a substantial improvement in the rate of our people accessing cataract surgery, diabetic retina screening, health examinations, eye health examinations. So we're seeing a significant increase, sitting around that 30%. 5 years ago, we were sitting at 11%. It's just so important that our people are accessing eye exams. We know that across this grand nation, we have a prevalence of trachoma. And if it's left untreated, that results in blindness. And, particularly in our kids, that age group of 5 to 9 years old, we again have seen a significant decrease. In 2009, it was sitting at 15%. 2019, that's dropped to 4.5%. Just focusing on that significant drop means that our kids are not going to have the enormous barrier of having to face a life of blindness.
What do you suppose leads to this increase? I know that when I go in for the health check at the medical service here in Brisbane, it's part of the checkup, yeah.
Yeah, Adam, you and I know what leads to that improvement. It's a reflection of the exceptional quality, solid work done by our Aboriginal community-controlled health services. It is just, again, another clear evidence-based example that culturally appropriate services deliver great results. And we want government to continue to see that, to understand the expertise of our model of care, and we want to see that supported into the future. We want to see additional funds coming into our communities that community can make a decision about how to lead that type of access. We want to see models that bring our people into our services to have these ongoing checkups.
What are some of the issues that one can have with their eyes, and what sort of difficulties, apart from the obvious, that come with it?
Our people face a whole range of challenges in this country, and to have the additional challenge of blindness or eye disease, and these are preventable diseases. We know that our people have 3 times more of chance of having an eye disease than non-Indigenous Australians. How could that be the case? What we're wanting to see is real investment in our local communities to be able to case manage. We want to see real investment in community-led models so that our people can continue to come in and access those eye health exams. And, with Vision 2020, we've had a partnership with them that has brought subsidised spectacles into our sector. So, if our mob come in and they need glasses, they can access that through our ACCHOs at no cost. They're the sort of early intervention responses that we want to see routinely for our people.